Welcome to Risk Revolution, a podcast series that examines all aspects of risk management in the life sciences industry. We'll talk to industry experts on best practices for identifying risk, assessing risk, measuring solutions, implementing solutions, and monitoring results. Here are your hosts, Nuala Calnan, Valerie Mulholland, and Laurie Richter.
Well, welcome back to Risk Revolution, our monthly series seeking to advance the maturity of risk management practices across the life science sector. As usual, we'll be covering topics that challenge professionals within the biopharmaceutical and medtech industries. And as always, we aim to shake up the paradigm to revolutionize the way in which we perceive and proactively manage risk. And I think we're going to do that today for sure. So for episode 32, our first of 2026, Val, Laurie and I are going to talk about risk thinking. Well, what is risk thinking, I hear you say, and where is the tool for that? Well, I suppose many of us initially learned, or indeed even taught, risk management through tools, scoring tables, heat maps, and long discussions about FMEA. And of course, the update to ICH Q9-R1 clearly identified that this was not the most effective way to deliver actual lower exposure to risks. So luckily, we're asking today, did we forget to teach about the risk thinking? And it happens to be Laurie's hot topic that she's presenting at the upcoming West Coast chapter of the PDA Quality Day in February. So Laurie, why don't you get us started and tell us more about risk thinking and what it means to you?
Thank you, Nuala. Well, I'm glad to be on this episode today that all three of us are here. I do want to shamelessly plug my presentation really quick too. It's on February 17th. At actually the Gilead facility in California, in Foster City. So I'm looking forward to that. So share the title of my presentation, I think kind of nicely sums up what we're going to talk about today. It's called Trapped by Templates, Reclaiming Risk Thinking. So what does risk thinking mean to me? I think the beauty is, I don't think we forgot to teach it, Nuala. I think we didn't have to. What we did was we taught so many other things like process and the tools and the templates, and we got procedures in place and all of that, which is also very value added and has its place. We stopped the human from being able to think about risk because it's inherently part of what we do. So I think as a human, we wouldn't survive to be where we are today if we hadn't have managed risk and thought about risk. It's second nature for us. We do it on a daily basis. This morning, as Val commented, I'm wearing a scarf and it looks like I'm out in the snow. I'm literally inside my house, but it's a little bit cold this morning. And we're also filming quite early where I'm at. And so I last night had to already think about, okay, how am I going to structure my day? How am I going to manage it so that I can be able to get up, be on time, be ready for the podcast? The lighting has to be correct. What am I going to wear? All of that had to be thought through from a risk perspective because it's like, what time of day is it? What's the weather like? Am I going to eat breakfast before or after? Because I also have several meetings. So how am I going to manage that risk as my day continues because it's quite early for me right now? So I was already doing that. Did I have an Excel spreadsheet in front of me or an FMEA? No, I wasn't scoring anything, but yet I really was doing all of those things. I just was doing it subconsciously and calculating it out and figuring out my mitigations. So risk thinking is something we already do. What I want us to do is think about how do we walk into work and still keep doing that, because something happens when we cross that threshold and we forget, or we're paralyzed, or we stop because we do have the tools and the regulations and the importance of our job. Please don't underestimate how I feel about that. It doesn't escape me. And that thinking about risk makes it a lot harder because we do want to protect that patient. But let's take a step back today and maybe think through how can we bring those things that we inherently are already doing on a daily basis for our basic survival and comfort and bring those into the workplace. So that's basically what it means to me, Nuala. Thank you.
And what about you, Val? What's your thoughts on it?
Yeah, well, I got very excited when Laurie suggested we have this discussion because it's a really good question. And I think for me, you guys know I'm passionate about QRM and risk thinking. But as it relates to decision making, and particularly, I suppose, decision making under uncertainty and what decisions look like when that risk thinking is real and the rubber hits the road. And to me, when risk thinking is real, I agree with you, Laurie. I think it looks less like a completed FMEA and more like a clear, defensible decision record that shows you how you chose a particular action under uncertainty. And and remembering that when you're unsure or uncertain, there's always chance that you're wrong. So I think mature risk thinking isn't about pretending certainty. It's about building in that one signal that tells you, Val, stop, look again. You could be wrong. It's that leading indicator, that trigger, that moment that triggers humble curiosity, that says something doesn't fit and I need to go back and check my assumptions and review my decision. For me, I think maybe that's the true marker of mature risk thinking. I think in regulated environments, sometimes I think we might be guilty of overreaching. We're trying to prove the future, which you can't do. We're not indulging in risk astrology. It is, we're trying a little bit of scientific prediction here. And, we say things like this process is validated when I think we know in our heart and soul that the process is yet to prove itself in the real world with real schedules and real people and real pressure and real constraints. So for me, perhaps that validated statement after your PPQ batches is provisional. And I think risk thinking might recognize there are edge cases in true operating conditions, and they're the ultimate test of control. And until then, we monitor risk with evidence and humility that's actively looking for that falsifying data. Do you know, Laurie, I must tell you a story because you triggered it in my mind there. I started my career many moons ago in R&D, and I think I was about 2 years into the job when I had a performance appraisal. And look, I wasn't too worried because I worked hard, ran the studies, I generated the data, etc. But I did find it painful every week poring over results that didn't seem to be telling you anything. Whereas my boss and my boss in particular, but my colleagues also, and they were always, searching and hunting for that one data point that said, there might be something here. Of course, it so seldom arose. I found this very frustrating. So at the performance appraisal, the boss said to me, very kindly actually, but he said, Val, you just don't seem to be as interested in what the data is trying to tell us as the rest of us. I think you should move to quality. And so I did, and I've been there ever since. But I have probably quoted that guy over the years. It's out of context, I know, because there's a grain of truth in what he said. Sometimes when we look at quality data, I think we're not hunting down that one data point. I think we are taking more comfort from the word assurance than we are from the word quality. We're looking for confirmation that everything is okay rather than searching with purpose for data that might suggest otherwise. And to me, that's risk thinking, that purposeful interest in that contrary signal. I don't know whether that makes sense to you guys or not, but there you have it. That's my rant on the topic.
Well, Laurie, why don't you take us back then to when ICHQ9 was introduced and how that problem was identified as in order for us to try and solve it?
Yeah, I will. But I do want to comment on that really quickly, Val. I think you hit it on the head, though. It's that there is no purposeful intent sometimes for our risk thinking at work when there should be. I mean, we all know that, right? We're trying to make a decision, we're trying to understand the risk, right? But when we're making those decisions at home, there is an instant impact. There is a purposeful intent because it's selfishly motivated, right? It's for me,
Right.
I'm making a decision for me and I'm going to feel that direct impact at work. I love that. You really just sparked that in me. There isn't sometimes we are sitting around grueling through a template and then at the end we really use the stuff to make the decisions that we needed to make? That's the question, right? Maybe we'll get there today.
Mhm.
But good point. I love that. So I do want to talk a little bit about history. And I mean, I'm so young, I'll try to dig into the history of, of pharma. Um, let's
You
go
had to
back.
read up on it.
Yes, I had to ask you guys. No, I'm joking. I'm joking. I was there. Okay. In 2002, there was a little thing called the Pharmaceutical CGMPs for the 21st Century, a risk-based approach. So that came out by the US FDA. And mind you, I'm going to be pretty US FDA centric in a little bit of this history walk because as a US person, I also very well aware that EMA is very well versed on risk management. So I'm just going to tackle it from that side. In fact, whenever I guide any of my clients around an EMA inspection, be very well prepared to defend those decisions, present that program, all of that. US FDA, there's always just this little bit of nuance there in terms of whether or not you understand risk and how you documented that decision, not so much the regulatory emphasis that I tend to see from the EMA inspections. But so back to my history lesson. So when that came, that was kind of a big shift for a lot of US people. It was a big emphasis at the company I was at the time, because all of a sudden we were going from like, we're not going to do this black and white, compliance, one size fits all thing. We're actually going to evaluate risk and we're going to consider properties of the product and the way it's manufactured and all of these kind of good things. So it was pretty eye-opening and kind of exciting for people. As is typical with pharma, we probably overreacted to to it a little bit, and maybe carried it a little bit too far. But we'll talk about that a little bit later. Shortly after that, ICH Q8, 9, and 10 came out pretty fast, pretty rapid after that. It was pretty the quality by design. I was in biologics at the time. My God, you would have thought that there was just this like just huge meteoric effect on biologics. And I think even today, people still struggle with that quality by design approach. But that was a pretty big deal. And then you had ICHQ9, obviously our sort of quote Bible here on this show, which was quality risk management. And then you had Q10, which was the end-to-end kind of approach, looking at your pharmaceutical quality system. All of those mentioned risk. All of them were kind of a fallout or an impact from the paradigm shift that occurred prior to that. That was a big deal, and it impacted companies quite a bit because even though they're guidance documents, obviously we certainly see them as requirements and regulations and things like that, and they sort of do become the C and the CGMPs, right? I think what happened after that, we'll get to a little bit later in this podcast, but I think that rocked a lot of people. People weren't sure how to progress forward. Risk thinking kind of went out the window, and we started getting really formal and structured about the approach. But that's kind of going back in history and kind of what we were trying to do there. Thank you.
Yeah. And I think, Laurie, that's a really good potted history there. I think then, was it about 15 years after ICHQ9, concerns were already being raised about a little bit of stagnation. We progressed QRM so far, but then it was sort of plateauing out off. And, I think to allude to something you just said there a minute ago, it was like we had the risk toolkit, but we didn't know what we were building with it.
Had no idea.
Yeah, and I mean, don't get us wrong. I think risk analysis is a hugely important step in QRM, and the tools add structure. And as you alluded to, they help us to determine the safest pathways and processes to make safe products. And, I also think they neatly support the way the engineer in us all thinks, in failure modes and causes and detections and controls. And it matches how many of us see the world. And they do give us then a clear and documented deliverable that can be produced in audit. And maybe that's a point. Let's face it, tools like FMEA produce a very neat auditable artifact. But the problem is it sometimes feels like risk management has happened, and we believe if the tools were completed, then the risk was managed. Even when the real value is probably in supporting future decision making. And, maybe FME in particular won the day because it's an excellent map. But it's not exactly a live GPS system that will navigate real world conditions when we have big risk decisions to make. And I know that was a concern you had, Laurie. How did FMEA become the thing? How did we end up treating the tool as the destination, not as the means?
Yeah. Yeah, I actually am still exploring that question from a human psychology perspective. How did we land there? But I think it was because it existed. It was known. Like you said, I think people kind of understood collectively how to use it. There was some comprehension there. But I think it was also because we got a little excited, as we do in pharma when something new comes. I think I must have been in so I joined into the quality risk management cult, I'll call it in a good way, in 2009. So it was 4 years after Q9 came out. I was I loved it. I mean, when I first read that document, I was like, oh my God, like wow, this is great. And I kind of threw myself into it as well. I think I went through like I think there was a 3 to 5 day course for FMEA at that time. Um, and and then I went through like a 7 day course or 10 day course of HACCP or something like that. Um, and that's where we went. I mean, we went to it right away. We were like, this is going to answer all our questions. Like this is going to be the map, like you said, even though it's not, Val, it is kind of at times a nice map of process controls and how it's managing the failure modes and all of that good stuff. I think we threw ourselves into that. I remember just delivering countless trainings for the next couple of years. Um, Flew around to different sites in the network of the company I was working in. And I don't want anyone who's listening today that sat through my training to think that was all in vain. It wasn't. It was just, I think we put the cart before the horse. So to speak, I think it was just we jumped into the formality of it all and the structure and the rigidity, the very thing that ironically it was supposed to remove from compliance. We actually went right to it, right? Because that's what we know. And I think we landed there and sort of got stuck there. But we'll talk about that a little bit later. Nuala, what are your thoughts on FMEA?
Yeah, I mean, I think everybody who's ever listened to one of our podcasts knows that I have a fairly unhealthy relationship with FMEA. But look, why did it become the go-to? Because it was there. Because it was there. And, it was widely used in other sectors and there were lots of examples available. And God help us, our obsession with training compliance. There was plenty of trainers out there to teach it, including yourself, Laurie, on, how we should use it. And I guess, because it had been developed, in the 1940s by the US military, to improve weapon reliability. And then it was adopted by NASA on their Apollo missions to minimize risks in complex systems, which I think it's an excellent tool for that type of complex systems. But the problem was then it got picked up by aerospace and then aeromotive or automotive. And it found its way by the time we were the tail wagging the dog, by the time it came into healthcare and pharma, everybody else was using it. Presumably, hopefully, they hadn't forgotten the horse as well as the cart. But we went straight to the compliance piece. Rather than really thinking about how are we handling risk here. So, and in theory, like it's a tool intended to shift the focus from reactive firefighting to preventative early stage risk mitigation. To be, deployed typically during the design and development phases of products and processes. But as you pointed out, Val, our assumptions in that stage are all provisional until the design withstands the test of the real world fires. Our assumptions are back office assumptions looking at 2D drawings. Now, I know we've probably progressed from 2D drawings to all sorts of lovely imagery now and AI walkthroughs and VR headsets and what have you, which all help. But the bottom line is the control and mitigation strategies that are often documented in FMEA are heavily influenced by the bias of the design team who were around the table at the time, because they're the people who know the system. And they already intend, I declare myself as an engineer, that everything we do is perfect anyway, so how could we possibly have a gap there? And it can, I'm sure, you guys have been in these situations, it can get quite defensive, in terms of people defending their design and saying, oh yeah, we already have an interlock or we already have, a threshold for that. And as you say, Val, looking at those edge cases, it's not simply often as simple as, if then else. If this happens, this alarm will ring. No, normally it's complicated by several other, confusing, messy activities that are happening at the same time. And therefore somebody doesn't respond to the alarm or it doesn't get, appropriately handled. So put simply, it was an easy ask to put FMEA into a policy or procedure, train the personnel on a template, execute it and tick the compliance box to make sure that it was there for audit purposes afterwards. But I think also in our implementation, there was another key weakness. And it was that by having that FMEA tool, it enabled a kind of a reductive approach to looking at failure modes of a component or a piece of equipment or the system that it was servicing. And it didn't, in the early days, focus on process, product and patient. And then certainly, it's only in more recent years that you start to see, and there can still be some pushback from the technical teams on this, discussions around the product and the patient finding their way into FMEAs. And that's one of the reasons why I don't like to look at it, because, the failure of this component down here, we're down in the weeds. And which is why we now have, audit trail reviews being called for, because, we can have computerized systems telling us that something happened, and that switch can be going on and off and on and off, and you have 100 messages in there and nobody's responded to it. And therefore, it's very difficult when you're doing your reviews to see the wood from the trees. Was that a critical alarm, or was that just a nuisance, loose switch or something on a door panel or something like that? So I think it facilitated us getting down into that component levels, equipment level, and not pulling us back up into, let's have that thinking about, how could this impact the process or the product, or ultimately the patient. So I'm sure everybody's sick of hearing me saying I don't think we're mature enough in our approach to risk management to be able to use the tool appropriately. And certainly when you see industries like the nuclear industry and other sectors using it, there's a lot more emphasis around the risk thinking and around, getting the behaviors right and all of those things that don't find their way into many of our typical FMEA templates. Now, I'd better stop bashing the FMEA and move on. Laurie, so if risk thinking is something we already do in all aspects of our lives, from getting up in the morning and determining what time breakfast is at, why does it feel so hard when we go across that threshold, as you say, when we walk in the door of work?
Yeah, that's a great question, and something that, especially as a consultant, I'm constantly thinking through, because I'm trying to figure out how to break through that. Why are we so paralyzed by that? And I think we've hit on a few of those topics already. One is, I think we got so structured about how we were doing risk management activities that it somehow short-circuited us a little bit, because it is a natural way of us thinking. I don't think as soon as structure comes into it, it's like we can't almost access that part of our brain anymore, because I'm so worried about the terminology. And we know, being in pharma too, we are surrounded by people who are quite typically afraid to be wrong, or we're constantly wanting to be perfect. We want to be the expert in our area. We don't want to mess up the template. We don't want to get the terms mixed up of it. Is it a failure mode, or is it a hazard? Is it, a hazardous situation? So I think we're so fixated on making sure that we're filling out all the right boxes and I'm saying the right things, that then I can no longer think about risk, because I'm not doing any of that on a day-to-day basis for problem solving. It's not structured in that way. However, it is structured. And I think we'll get to that a little bit later in this podcast. We are structured in our thinking as a human. We're not willy-nilly about it. There is a process, but it's not quite the same structure as we're asking people to do when they walk into work. And I think that's breaking us a little bit. We can't think in that way. And so what I used to do to facilitate was, I actually used to use, and I don't even know if it still exists today, but I think it was called MindJet Manager or something like that. And it was a tool that was capable of allowing you to kind of free think, and you could sort of have bubbles and drag and drop and move things around. I think that helped a lot with people. But basically, when we cross that threshold, sorry, I think we're struggling because it's so confined. It's so about compliance, like you said. And I'm going to add something that Val just triggered that light bulb moment for me this morning. It's about decisions. How many times have we walked into a risk assessment when we hear people grumbling, going, what are we really going to do with this? We already know the decision's been made. Or are we really going to do anything with it anyway? Or this is retroactive, right? So I feel like that was such a great point, Val, that if I don't feel like there's anything I'm going to get out of it, how much effort am I really going to put into it? I'm a busy person, right? That's what everybody's thinking that's coming into that. So I think that makes it difficult. I think it's the compliance piece. I don't want to do anything that's going to inadvertently harm someone or hurt the product. So I'm fixated on that. So again, it's stopping my capability of free thinking. And then the last piece that I think of too is the culture. Are we enabling and empowering people to actually say what I think might go wrong? Because I don't know about you, but a lot of leaders struggle with hearing what might go wrong from their staff. I don't know if sometimes we're creating that safe space. I know we've talked about that in past episodes as well. But again, I implore people that this is very important. They have to be able to feel like they can speak freely, say what they think might go wrong, assess that appropriately. It's not a free for all of everything I think is going to go wrong is going to go wrong. We're still going to walk through some kind of assessment of probability and things like that. But I think those are the key high level things that I think are causing us issues when we get across that threshold. I don't know, Val, what are your thoughts on that too?
Gosh, you're so right, Laurie, and so much what you said there. If not everything, everything everything you said there. But and I was reflecting on this with in relation to decision making because, yeah, to build on what you said, I think the work environment changes the psychology of decision making. We might be still doing risk thinking in a way, but we're doing it under constraints that push us to prioritize or treasure different criteria. We're now in work, things like defensibility becomes important and consensus. And as you said, compliance, rather than truth seeking or authenticity or things that are important to us in real life. And I suppose in real life, most decisions are private. We're in control of many of them, not all, but many of them. And again, many, but not all are reversible. But I think in pharma, we're talking about decisions or problems or risks or errors that could affect patients, supply, the regulatory standing of the company. That's a lot of responsibility and a lot of judgment on our decisions. And those decisions are living forever in our records. And outcomes can be judged years later with hindsight bias by people who weren't there, questioning our thinking at the time and the actions we took. And, we're conscious of that all the time. So I think maybe we default to decision criteria that sit more comfortably with our own self-preservation instincts in work, which is, what looks like the safest outcome here for an audit and what would the company's preferred outcome be. And I think then, when we start thinking like that, maybe we're less willing to go out on a limb for that one data point that might mean something else or something less assurance. And I think in everyday life too, I'm sure you'll agree with me, it's normal to say I'm not sure. At work, uncertainty feels like weakness or it communicates like weakness. And certainly, if I cast my mind back the way I was trained as a quality professional through the years, it was to back my decisions with confidence. I was often told, and to be fair now, I've often heard myself advising others over the years as well. My bad. But I was often told if you can't stand over that decision with confidence, how do you expect a regulatory inspector to be confident in the course of action? If you can't sell it to yourself, how can you sell it to in an audit? And but the truth is, I found myself forced to make decisions with incomplete information on somebody else's clock. And, then I was defending those decisions later in audit as if they were made with a confidence that didn't exist when I was making them, And that's the truth. Decisions get made under pressure, release deadlines, production realities, supply commitments. And if risk thinking is meant to support those decisions in those contexts so that we can make them better, there's something breaking down, I think. I don't know what do you ladies think? Where's the gap? Where's the problem here? And what do we actually do about it?
Yeah. Yeah. Well, I have to say that I was going to add to your things that you hear when you're a quality professional. I always heard, can you pass the red face test when you're presenting to an auditor? So that's very much like but the one that I actually landed on that I think helps me from a risk perspective is, would you give this to as a result of this event, how does that impact that product? And would you give it to your family or yourself? And that kind of restructured it for me. It's one thing to defend something in front of an auditor. It's another thing to actually put that in your body. And I think that made me look at it differently of how am I evaluating this risk? How am I looking at all the risk? Would I feel comfortable if I knew what had happened to this product and I was now going to take it? Because most patients don't know, right, what's been happening behind the scenes. So that kind of changed things for me, actually. I don't know, Nuala, if you have other mantras you've heard too.
Yeah, and look, I certainly in all the work that I do around risk, one of the key things I try and convey to everybody in getting them to think about risk in a different way is it's okay to say you don't know. I mean, like just what Laurie's saying, I'm not sure is not something that we hear a lot,
Yeah.
because you're supposed to be experienced and you're in a role and you have the responsibilities. But I really emphasize with teams, it's okay to say, I actually don't know what the right answer is
Yeah.
here. So what are we going to do? Let's go and look for some data. Let's get some experts into the room. Let's look at the science. If we have to run some further tests, let's get some data that we can at least then look for that one missing data point or connect the dots on a couple of the data points. But it's certainly, very often I find in those risk-based decisions, to the point that you made there, Val, is you're on somebody else's clock. Very often you're in a meeting and somebody is saying, is it go or no go? What's the answer? And sometimes you have to actually put your hand up and say, we're not at the point in which we can actually give you that decision at this point in time because we don't have enough data or we don't have enough knowledge, or we have to go and look at it. And you're not being asked for an opinion. You're at that stage you're being asked for a science and knowledge led decision. So there's no point in putting your finger in the wind and saying, well, I think we're okay. I think we should be grand. That's not what we're being asked. We're not being asked for an opinion. We are being asked for our analysis of the current situation based on the data that we have. And knowing, just as you said there, Val, the data may change. And we need to be able to cycle back and do those reviews, which again, we have not been traditionally good at, of looking at our, recalibrating our decisions and actually looking at our decision success and calling that out and saying, well, previously we made these decisions and we made it with the best faith on the day, with the data we had. But looking back on that now, we can see where the gaps were, that 2020 hindsight vision. But we're not good at doing that and documenting that. So for me, I think that is, if we can build in, you mentioned the phrase earlier on, I wrote it down, Val, humble curiosity. If we can build that into the process of saying, without being aggressive or, going against somebody else in the room and somehow creating a bit of political tension in the decision process, we should be able to be humble and still say, how do we know that? What evidence do we have to support that? Or what is the risk if we're going to own that risk, if we're going to go down that path? What is the risk that we're exposed to? And at which point will we put up the flag to say, okay, we need to back up here. We can continue. And that's another thing that I find, again, we're very collegiate, coming back to this kind of behavioral science piece. We want to do well. We want to help the company move forward. We're not great about going backwards. So, with the best of intentions, people want to help to move the situation forward. But sometimes we have to stand still and actually assess, do we need more information? Do we need more opinions in here? Do we need to get some expert opinion? And we're not great at putting up the checkered flag and saying, stop, we actually have to halt here. Or the other alternative is where we don't have good decision makers and they're happy to kick the can down the road, and that's increasing the risk, and that can also be a major stumbling block with some of our decisions where we don't make it, like actually not making a decision, rather than the go no go situation, but actually saying, oh, let's regroup again next week. Sometimes that's even exposing us to more risk. At the time.
Speaking of risk-based decision making, I forgot to ask the question of Val because this is near and dear to her heart. Tell us what this looks like. What does good risk-based decision making look like, Val?
My specialized mastermind topic, yeah.
Yes.
But I think what you're both saying there is so interesting because I think we referred to it earlier how risk QRM might have plateaued off because I think we got really good at using it to plan our risk controls and our
Yes.
engineering controls. But I think it had a second function. It has a second function. It has a second function in other industries, which is to support decision making. And I don't quite think we've taken it with us on that journey. And so, what is the best way of using all that risk knowledge we build up in risk assessments and in risk review and in our risk communication meetings to support decision making? Well, I'd say step one is to plan for them because most PQS decisions we meet are grey swans, not black ones. Black ones are impossible to predict. There where something comes out of the extraordinary that you never would have thought might happen. But the grey ones are the ones that are sitting in our risk assessments with a high severity score and a very tiny little likelihood score. And that's because, we have good GMP controls and good process design, and we're using our QRM to put those things in place. So we're being very successful on one hand, but we're also in parallel scoring our likelihoods, our big situations with a low likelihood that keeps them off our radar. And most of our worrisome decisions into the future are probably grey swans. They're predictable, but they are unlikely. But when they do happen, we will be furiously paddling in real world messy operations like a swan underwater trying not to drown. We won't be idyllically floating and gracefully floating along in smooth waters. So we need to plan for these situations, and we should be confident that we have the risk knowledge and the knowledge pathways to the people that are down there in the real messy world, in real decision-making scenarios, with constraints and trade-offs that they have to make. And, they're asking questions like, can we move the batch to the next hold point? Can we repeat tests compliantly? Can we replace a part safely? Each of those questions has a trade-off. And we need to design our QRM to support those real-world risk thinking. Using more tools, I hate to add, but there are tools out there for that purpose. Scenario planning, pre-mortems, Nuala, our old friend, the bow tie, which, we try to advocate at every opportunity, but that's a really useful tool here. So while you were talking, I doodled down 8 little prompts that I think might form maybe a decision checklist and bring risk thinking into our decisions. So step one, I think it's important to say, what are we deciding? And when are we going to have to decide it if you're looking into the future? And, what will be the messy real world urgent decisions we'll be making into the future? And can we look at those now? And step two, then, what are our options? What can we choose? What are the circumstances we take that option, and can we defend that option versus other options? Like if we decide to move the batch on to a next hold point, can we defend that? If we don't, can we defend that? If we do more testing than our OOS procedure says we should, how do we defend that? Were these the circumstances that we needed more knowledge? So, so we have to frame these things, and you put it very strongly there, and this is my third little doodle, Nuala, the uncertainties. What don't we know that matters? Face up to those things, and then, yes, we look at, our likelihoods and detectabilities and severities and, looking at things like product availability, how big are the consequences here? We do need to bring that to the table because that informs us of our priorities and the extent of the relative and different conflicting risks we might be dealing with. And then when we do choose an option, what residual risk remains? Who owns it? How are we going to monitor it for that one data point? What's the indicator? What threshold does it have to creep over before we, ask our questions? Do we have to go back and revisit the question? Who owns that process? What are the stop rules here? I don't think that's something we talk about enough. What triggers us to roll back
Yeah.
to this question? And how long are we going to keep an eye on this? What's the review date? So I have 8 little prompts there, which to me is what good looks like. Not perfect prediction, but a GPS that allows us to navigate maybe through our choices and to make uncertainty transparent and allow us to document these things more thoroughly. By the way, if anybody wants more detailed toolkit for real world Grace One paddling, I'm going to shamelessly advertise an e-course I've just launched as well on risk-based decision making. So if you find us on LinkedIn, you'll find me, you'll find your way to that as well. So anyway, that's enough from me, but it's a very heavy topic. There's no doubt about that. And we have a lot of learning to do in this space, I think.
We do. And I'll tell you, I'm signing up. I saw that coming through on LinkedIn this week. So I'll be signing up for that e-learning course on risk-based decision making as soon as possible, Val. So thank you for that. And also, I can remind them while they are linking in with you is your fabulous Monday mindsets, which I'm loving.
I love
My Monday
those.
morning
Yes.
wouldn't be the same without them. Yeah,
They're
exactly.
very popular.
Yeah,
Yes.
I'm loving them. So well done, Val, getting us all
Thank you.
motivated every Monday.
Yeah.
Your Monday mindsets with a little thought for the week on risk.
week.
So well done. So final question for you, Laurie. What are some simple ways that teams can start talking about risk without pulling up a template?
Yeah. Okay. So I've actually been posed this question a lot recently. And what I find interesting is that when I'm sitting in meetings as a consultant, it's always so much fun because you're the third party. So it's like you're sort of the one seen from the outside when you're watching your clients and their team members interact. It's easier for you sometimes to see the things, right, that need to be corrected or where there's actually really great information happening. It's just because they're so close, they don't always see that. And what I see a lot of is people will comment like, for example, hey, Lori, can you help us with this risk assessment? And so I'll sit in the first meeting, kind of sort of hashing it out. What are we trying to do here? Actually, guys, like especially depending on the type of decision being made, as you just outlined, Val, so nicely, most of the time the risk assessment's actually done during that session, but people don't even know it because they don't even know that they're actually talking about risk already because they're not seeing a spreadsheet in front of them. They don't see a scoring criteria. It doesn't seem so formal, so they don't even realize it. So one time I was actually in a meeting, and at the end of it, they're like, how can you help us, Laura? And I said, well, you just did it. And they were like, because we just don't have time to do the risk assessment. I don't know when we're going to get that on the books, that kind of thing, right? And I said, you just did it. I actually took down a bunch of notes and I'm going to try to structure it in a nice table for you to make it presentable, to make it make sense, right? Like you need that structure for that. But you did the risk assessment. And they were like, what? And so I feel like it is happening, and I think that's where AI could be super powerful. Is I don't know about you guys, but I go to the doctor sometimes, and the doctor will be like, "Hey, just so I have AI like listening to us. I'm not going to be taking notes. It's going to be taking notes, that kind of thing, so that I can give their approval." I'm like, sure. I'm thinking to myself, there's a lot of times, AI is capturing or transcribing what we're saying on Zoom. It would be so great if we could take all that and somehow have AI structure it into a risk assessment because it's actually happening a lot of times in meetings. So I guess my takeaway for folks is if you just start talking about it in terms of removing the terms that you're used to hearing from FMEA and hazard, and you just say, the things that Val just mentioned, what concerns you? What are you worried about when we talk about this option? What may cause this option to fail? Or where are we potentially going to face roadblocks in this decision we're trying to make? That's all risk management talk. It's just not mentioning the word risk and or any of those other structured terms. If you start introducing that into some of the meetings, I think that's going to change. That's where you start to make that cultural shift. That's where you start to make it safe to talk about risk and actually talk about risk without getting so bogged down. That doesn't mean there's not that place for the structured tools, and we've talked about that. There is a place for that, and you do have to structure the outcome of that discussion so that it makes sense that you can generate a decision from that and defend it. But I think just introducing some of those simple, basic things into your meetings makes a huge difference, and actually capturing some of that stuff and then following up on it. Back to the decision thing. Are we going to do anything with this, or are we just going to keep talking about it? Because how many times have we been in meetings where we're like, we still haven't made the decision? And I think it's partially because we haven't talked about the risk and we haven't written it down. And so we keep revisiting it because it's bothering us, and we don't know why it's bothering us because we don't have enough information to support whether it should bother us or not, because we haven't done that quote assessment. So I think just introducing some of that language and some of those removing some of those formal structured terms from risk management will actually get us just talking about it and starting to basically write it down, make that shift in the culture.
Brilliant. Well, I guess that's a wrap, ladies, for our first Risk Revolution episode of 2026. As usual, we'll be back each month on a range of topics with a mix of guest interviews and, of course, our book club recommendations, where we hope to share some of our favorite authors and books in the area of critical thinking, risk science, leadership, and, of course, human behavior. Please do subscribe to the show wherever you get your podcasts, so new episodes will miraculously make their way into your feed. We have, as we mentioned before, set up a LinkedIn Risk Revolution podcast page, so please do join us there and feel free to message us there with your thoughts or ideas for topics for us to discuss. And finally, Val, will you share your little doodle on risk thinking decision checklist, your little 8 prompts maybe in the show notes?
I will, and I'll also encourage anybody that's in the area to go to Laurie's talk. I'm disappointed now I can't travel that far for it. But
17th
Our
of
weather
February.
is good, Val. Our weather is good.
17th of February on the West Coast. Laurie, what are you going to share in the show notes this week?
Yeah, I actually stumbled across a YouTube video because I'm always doing research on risk management, and it's called Risk Management Basics. What exactly is it? By David Hilson, the Risk Doctor. He actually has quite a series of different risk videos, and he was new to me, so it sounds like you guys have seen him. This one's like a 5-minute video. It's really exactly everything we kind of talked about, but I didn't know this video existed before we talked about it, so I thought that was really cool that we nicely aligned with that. And then I'd like to share one of Val's articles, Steps Towards Demystifying Risk-Based Decision-Making. That's with Val and Anne Green from TU Dublin. I think that would be really great. And then Val, would it be okay if you shared a link for your risk-based training e-learning? I think that would be really great too.
Absolutely.
Yeah.
I'm trying to democratize risk-based decision-making. So absolutely.
Right.
Well, very good. So, it's a goodbye then from me, Nuala.
Oh, yeah. Goodbye from Laurie.
And goodbye from me, Val. Mind the story you're telling yourself about the data.
Thank you.